So thank you for the kind introduction. As suggested yesterday by Dr. Warwick, it's quite difficult to make a valid comparison between treatments, either through randomization or clever study design, but I think we have to at least try. So I'd like to spend the next few minutes showing you the results of our study with which we compared collagenase injection with limited fasciectomy. These are our conflicts of interest. So the efficacy of collagenase injection, I think, has been demonstrated by several high-quality multinational randomized clinical trials. However, studies directly comparing collagenase injection with the more established surgical techniques are rare. And therefore, our purpose was to compare collagenase injection with limited fasciectomy in the treatment of Dupuytren's contracture in actual clinical practice. So we used a prospective cohort of patients who were treated between 2011 and 2014. Our inclusion criteria were both primary and recurrent cases, and we excluded patients who had multiple digit involvement and those who had a concomitant hand condition that could confound the outcome assessment. So collagenase treatment technique was according to manufacturer instructions. That meant 0.25 ml for MP contractures and limited to 0.20 ml for PIP contractures. And then manipulation took place to attempt rupturing of the cord approximately at least 24 hours or 72 hours after treatment. Our primary outcome was the degree of residual contracture assessed between 6 and 12 weeks after treatment. And our secondary outcomes included patient-reported hand function, as assessed with the Michigan Hand Questionnaire, and adverse events. Because we anticipated differences in the baseline characteristics of both treatment groups, we used propensity-score matching, which is a statistical approach that allows investigators to account for a large number of observed confounding variables and is considered particularly useful in situations where randomization can be unfeasible or complex to achieve. So we started off by identifying a total of 397 patients, and after applying our eligibility criteria, we remained with 218 patients, of whom approximately half underwent fasciectomy and the other half collagenase. This is a large table. Basically, it shows on the left part the baseline characteristics of both study groups. As you can see, the MP contractures were on average more advanced in the collagenase group. However, the PIP contractures and the DIP contractures were less advanced as compared with the limited fasciectomy group. And using the individual propensity scores we calculated for each patient, we were able to identify 66 patients in both treatment groups who were, apart from the treatment received, very similar in all baseline characteristics, as shown by the right part of the table. So then the outcomes for these two matched groups. On the figure on the left, you see that both treatments in the short term achieve a non-significant difference in for MP contractures. However, for the PIP joint, we found a significant difference in favor of limited fasciectomy in terms of contracture correction. And then secondary outcomes, we found that both the patients who were treated with collagenase reported significantly larger functional subscores in the MHQ questionnaire in satisfaction, activities in daily life, and work performance, but the other ones were not significantly different. And with regard to complications, we found that all serious adverse events occurred in the fasciectomy group. There were 3 tenosynovitis that required an intervention and 1 nerve injury, as compared to 0 cases, but mild complications were not compared because many of those were specific to collagenase treatment. So in conclusion, I think our study is one of the first in its kind to use this statistical approach to make a direct comparison between collagenase injection with limited fasciectomy. And our primary finding was that for affected MP joints, both techniques were similar in terms of contracture correction, but for affected PIP joints, LF was slightly more effective. However, the larger increases following collagenase shows that the treatment has a offers a faster recovery. From a research perspective, I think our study shows the value of propensity score matching methods to make an inference on the comparative effectiveness of treatments in Dupuytren's disease. Thank you.
Thank you very much.